Hello, everyone, and welcome to the launch of the Spinal Cord Injury Healthcare Transition website. I would like to start by introducing Alison Barnes, who is going to do a welcome to country.
Yamandu Marang, Baladu Wiradjuri Yina, Yuandu Alison Barnes. I hope you're well today. My name's Alison Barnes and I'm a proud Wiradjuri woman. Today I'm sitting on the beautiful lands of the Darug and Gundungurra people here in the Blue Mountains. And I would like to take this opportunity to pay my respects to their elders, past, present and emerging, and especially pay their respect to the traditional custodians' connection to and care for land and water here in the Blue Mountains. I extend that respect to whomever are the traditional custodians of whatever lands you're sitting on today. I always love supporting new things in healthcare because as the mother of a child with a chronic condition, although it's not a spinal cord injury, anything new always brings a sense of hope. And I think as healthcare workers, that's the most important thing that we can give people. A sense that of hopefulness for the future. So I hope that you enjoy today, and thank you.
Thank you, Alison, for that beautiful welcome to country. For those of you that don't know me, my name is Emily Bray. I'm a PhD candidate at Western Sydney University. Today I'm going to be introducing you to the SCI Healthcare Transition website, which was developed in collaboration with young people with spinal cord injuries and their parents and caregivers to support them in their move from pediatric to adult healthcare services. So we're going to hear from a young person with a spinal cord injury and a parent that helped co-produce the website. We're going to hear from Dean Pan, who's a pediatric peer support mentor who features on the website, and from Jodie Thompson, an experienced clinical nurse consultant who will speak to the importance of supporting young people during what can be this challenging and daunting time. So to begin with, I would like to extend my deepest gratitude to the Spine Care Foundation for funding this research project and for their ongoing support. I would like to invite Isabel Chapman from the Spine Care Foundation and Northcott team to say a few words.
Thanks, Emily. On behalf of the Spine Care Foundation, which is a division of Northcott, I'd like to extend a very warm welcome to everyone and thank you for joining us today. Thanks, Emily and Western Sydney University for this opportunity to be part of the launch and this very important website. Spine Care has been supporting children and young people affected by childhood spinal conditions and their families and the broader community since 1981. It's been achieved through investment in research, resource development, scientific meetings, and through our scholarship program for people who use wheelchairs for mobility to attend university. And it was back in 2018 that Western Sydney Uni were awarded this research grant on the merit of two key things. One is the topic of transition. We acknowledge that the move from paediatric to adult health services coincides with lots of really important life events for this young person, HSC exams, learning to drive, a really great social life. And so having earlier information and a tangible tool for a young person to navigate this process is a great thing. And the second thing on the merit is this approach of co-design. And you'll hear a lot about that within the next hour. And we really believe that this is central to the website being a really meaningful resource for end users. So Spine Care are very proud of the strong relationship with Western Sydney Uni and the spinal injury and conditions community in general. And we're equally proud of the commitment and the rigour that Emily has applied to her PhD studies and the development of this website. And we extend the acknowledgement of all the terrific support of Associate Professor Lucy Ramjan, Emily's supervisor, and all the research partners with a lived experience who are essential contributors. So congratulations to Emily and everyone involved.
Thank you, Isabel. Now, I want to start now by giving you a bit of background into how I came to be involved in this project and a little bit about the website's development. So my passion is supporting individuals with a spinal cord injury and other disabilities live their best lives. Now, I believe that the first step to living well with a spinal cord injury or any disability and being able to fully participate in life is maintaining your health and wellness. Unfortunately, secondary health complications arising from spinal cord injuries, such as pressure ulcers, bladder and bowel dysfunction, and chronic pain, are known to negatively impact on individuals' reported community participation, employment, satisfaction with life, and quality of life. So simply put, any one of these conditions can limit your capacity to participate and enjoy life. And I'm speaking from personal experience. As soon as I get a hint of a pressure area, I'm on bed rest, and this limits my ability to work, but it also means I can't go to the park with my daughter and do the things in life that bring me joy. So in theory, if we can support individuals living with spinal cord injuries to maintain their health, perhaps this will give them a chance to actively engage in their communities and improve on outcomes like employment and participation in the community. So that brings us to why I wanted to get involved in this project. When I saw the advert for this PhD that wanted to explore how we can best support young people with spinal cord injuries in their transition from pediatric to adult healthcare, I thought it fit really nicely with my passions and beliefs. So what have I discovered? Research on transition for other chronic illnesses and disabilities suggests that the move from the children's to the adult healthcare services can present a hurdle to maintaining continuous age-appropriate healthcare. As a result, young people get lost in the transition, stop receiving appropriate healthcare, and as such experience health complications. And so I'd like you to take a moment to kind of think back now to when you were 18 and what you were going through at this time. Perhaps you were moving out of home, you're starting a new relationship, maybe you were traveling or starting university or work. Was your health a priority for you at this time? So would you have spent time organizing your 6-monthly bladder Botox, or would you have spent that time planning a road trip around New Zealand with your best friends? I don't know about you, but I certainly know which one I would have preferred to have done. So it's really easy to see how young people get lost in this transitional period. So my hope is that through this project, we can at least ensure that young people have access to information on the healthcare services available to them and are supported to build the skills and confidence required to be proactive in their healthcare. Maybe in this way, young people won't feel like they have to make the decision between their health and participating in life's exciting events. So, after learning more about what the transition process was like here in New South Wales, I began my research by exploring what the experience of transition was like for young people with spinal cord injuries and their parents or caregivers. Regrettably, what I learned confirmed what I had read in the literature, in that the move from pediatric to adult healthcare services is fraught with challenges. So what I found was that young people were scared and overwhelmed about the prospect of entering into new environments, and that this fear became particularly poignant when young people spoke about the trusted and supportive relationships they had with their pediatric healthcare providers and the daunting task of having to start from scratch to establish new relationships. Participants explained that they were poorly prepared for the transition process. What information they had received was verbal and lacked detail. The lack of clarity around this transition process meant that for most participants, the transition to adult healthcare seemingly occurred overnight without a formal handover. Participants reported a lack of communication between pediatric and adult healthcare. which as a result meant that information was lost in the transfer process. As such, they had to repeat their traumatic stories over and over and over again, which, as you can imagine, was quite draining. So after getting a better understanding of what the transition experience was like for young people and their parents and caregivers, I began to question, how can we bridge this gap between child and adult-centered healthcare and provide young people with spinal cord injuries and their parents with the knowledge and skills required to navigate the adult healthcare system? So the aim of my PhD was to co-design, develop, implement, and evaluate an intervention to support young people with spinal cord injuries during their transition. And I want to emphasize the co-design element here. You know, in keeping with the motto of the disability community, nothing about us without us, I personally believe it's essential to include people with disabilities and research on and about them. Including end users in disability research brings a specific expert knowledge based on lived experience to the research, which may not be held by the researchers themselves, and results in more appropriately designed interventions. Furthermore, co-design principles foster empowerment as people with disabilities gain control over their lives and make decisions on matters that affect them. So in the end, we held 2 co-design workshops, both via Zoom, one for young people and one for parents and caregivers. We used what is called the future workshop method to facilitate discussion and generate ideas for the development of the intervention. Now, this method consists of 3 phases. You have a critique phase, where participants are asked to identify the deficits and challenges related to the healthcare transition experience. We then had a fantasy phase, where we discussed, okay, in a perfect world, how can this be achieved? How can we meet that gap? And then lastly, this implementation phase, where we tried to turn these perfect world ideas into a design for a practical and realizable healthcare transition intervention. What was nice is that young people with spinal cord injuries and their parents and caregivers were very clear about their needs and their recommendations. Overall, parents wanted an intervention that supported their children in achieving greater independence. Young people wanted an intervention that offered a space for peer connection, and both requested that the intervention must support a coordinated handover between services. So, in an attempt to achieve these outcomes, participants suggested that the intervention include information on the transition process and the adult healthcare system, not only on the how the transition would take place, but on the services that it could help, what each of their doctors do, so both their old and their new doctors, how the adult healthcare services operate, what medical tests they need, how often, and tips on what questions to ask healthcare professionals. Interestingly though, what was most important was to have this information available for them to consume in their own time. Participants also wanted more written information on their medical history, and they suggested that having a personalized booklet that they could give to new doctors would be advantageous. They wanted the transition to be staggered, so from approximately 16 to 24 years. So in this way, the intervention can assist with those additional life transitions occurring simultaneously. So, for example, the move to tertiary education and work, move to living out of home. Perhaps the intervention could also address common adolescent concerns around sexual health and sexuality, independently accessing the community, driving, and mental health. So as I mentioned, from parents, there was really this focus on providing the opportunity for young people to learn about their healthcare and support services and gain and have the space to gain these self-management skills. And then for young people, there was this focus on accessing support from people with a similar injury so that they know that they are not alone in the whole process. So based on these recommendations, young people and from the young people and their parents, it was determined that a website would be an appropriate platform on which to deliver this suite of information. Now, it gives me a great pleasure to introduce a few of the individuals that have been involved throughout this whole project. Unfortunately, our first speaker, Kira, had to send in her apologies, but she did send me something to read out. As a little introduction to Kira, Kira's been involved in the co-design of the intervention, the SCI Healthcare Transition website, and has sat on the project's reference group. Kira has qualifications in events and community service and fitness. She's a youth ambassador for Canteen, and she works as a childcare educator. So she's a busy young lady. I posed 4 questions to Kira, and I will read out her responses. So my first question that I asked Kira was, what was the experience like participating in the co-design of the website? And this is what she has to say. Kira says, it was really good and meaningful that I have helped people in similar situations to what I have been through. Knowing that they can access the content easily and have the information right there for them at all times. It was really rewarding. It was a really rewarding experience and something I'm proud to be a part of, knowing that it will help so many people. Emily responded well to any feedback that I gave to improve the visibility and usability of the website. I'm grateful that the website was created because it's very much needed. And then asked Kira, what is the importance of the website? And how could it have assisted you in your move between healthcare services? Kira says, the website produced is incredibly important. Having a resource for adolescents to understand the process of transitioning, where they can access relevant information and have any questions asked, is very important. This resource would have undoubtedly assisted me moving from child to adult healthcare services. As a young person, moving to the adult system was extremely stressful and overwhelming. I didn't feel ready to leave the services of the Children's Hospital. Having a resource like this would have reassured me as well as helped me maintain more independence in the control of my healthcare. I believe a service like this would have allowed me to have more of a day and reduced my reliance on my parents and other healthcare professionals to navigate the system. I then asked Kira, what is the value for young people and how it would benefit them in their transition? Kira said, this resource is very valuable to young people due to it being a digital resource and easily accessible at all times. It can be hard to find the right person to talk to, and I understand some young people may not be comfortable reaching out to their health services themselves. Therefore, a resource available to them right at their fingertips would be much less overwhelming as well as easier to navigate. I'm sure it would make these processes less stressful for young people. And lastly, I asked Kira, how could health professionals promote the use of the website? And Kira says health professionals could promote the website by having brochures about the website available at their clinics so they could spread the word to patients and their families who are about to transition. I think this would make people feel more confident and independent about their next steps, also promoting the website across social media platforms that young people are already using, like the Children's Hospital Facebook page. So I'd like to thank Kira for sending those responses through. It's very insightful. And I would like to introduce you to our next guest, Anthea McClintock. So Anthea has a son with a spinal cord injury who is currently embarking on the transition from pediatric to adult spinal services, as well as his HSC this year. Anthea has been involved in the project providing a family perspective to support the design of the website, and Anthea will share her family's experience and the importance of preparing our young adults to self-manage their future health needs with confidence and to live well with their injury.
Thanks very much, Emily. One of the best parts of being involved with Emily's project was the opportunity to talk with other parents who have a child with a spinal cord injury. While each of us were at different stages of our journey, sharing those experiences and challenges as we provided input and suggestions into Emily's project was a really good thing. For us, the website is about helping our family members live their best life. Harrison's now almost 18, and we've started our transition process, and the website is proving useful for us in three things. Firstly, as a roadmap to help us know what we have ahead. Secondly, as a checklist to ensure we have not missed or overlooked anything. And thirdly, as a source of information for Harrison so that he can take control of his healthcare with greater confidence. The last thing is the most important of all. The first two are just to give me greater peace of mind. The checklists and reference info are great, particularly when you're weary and are juggling many balls. Most teenagers just want to enjoy living life as usual as possible and not having to think all the time about the things they need to do, manage and keep track of to stay healthy with a spinal cord injury. The website has tips on questions to ask and the templates have key information often needed by health professionals. These templates mean that Harrison has the information he needs on hand when he needs it. The schedule of health appointments is a useful reminder for us both. We can take that to our doctor's appointments, check we have not missed anything, and that we have referrals in place that are needed. Kids have a long time to live with this injury. Life gets busy, and it can be easy to overlook the things that we need to monitor for good health in the long term. Kids don't want to have to explain their circumstances all the time. With the medical summary template, this information can easily be sent to new healthcare teams so that conversations can focus on the future and not the past. The links to other info and resources by stage of life also helps with a lot of questions that kids may have going around in their minds, but are reluctant to ask their parents about or are not sure where to go to for advice. Excuse me. For health professionals, introducing this site to families as they discharge from hospital would be a really useful thing. Reminders from the paediatric outreach teams about the website at key stages as they work with families would also be helpful. GPs that work with our kids in the community would also be beneficial to have this resource as they help keep families on track. You can never guarantee that your son or daughter will remember all the things that they need to. This website increases our chances that as they are living their life as a young adult with a spinal cord injury, they'll remember at least some of what they need to stay well and who the health professionals are that can play an ongoing role in helping them live their best life. And I'd just like to say a very big thanks to Emily for this project on behalf of all the families that she's worked with and all the families that she'll have with in the future. Thanks, Emily.
Thank you, Anthea, for sharing your personal experience with us. I know your assistance from my end is greatly appreciated, so thank you. Now, I'd like to welcome Dean Pan. Dean works as a high school teacher, as well as with Spinal Cord Injuries Australia, SCIA. He supports young people and their families in adjusting to life with a spinal cord injury. And he features on the SCI Healthcare Transition website videos where he reports on his experience with a spinal cord injury and provides expert tips to young people and parents and caregivers discussing his peer support work. Dean, welcome.
Hi, thanks, Emily. Just wanted to, just share a little bit about what I do at SCIA and stuff like that, and my involvement in the website. So, Emily, she basically contacted me and then just wanted to know just as much as she could about the peer support service that we do for pediatrics now, which is actually quite a new service. And it's been a gap in the system for quite a long time. And basically what peer support is when someone has lived experience with a similar condition to another person. So they become like a professional and they basically will meet with the person who has a spinal cord injury. Like, so I've got a spinal cord injury. I've had it for 10 years, and I will meet with a person who has one, and then we'll just kind of walk alongside each other, theoretically, and just do life. And they'll often ask me questions and do that kind of thing. They might ask for advice, or I might ask them questions about how their bowel, bladder, and whatever else is going on, just because that's the kind of thing that a lot of people who have spinal cord injuries have to have a lot of close attention to. So I was involved in creating the website by going to Western Sydney University, and Emily and I did a lot of videoing and stuff, and she basically interviewed me, and I was in front of the camera, and then we also went and did some B-roll footage and stuff like that. But to share a little bit about my transition, I basically found the navigating the transition a little bit overwhelming, because I'd grown accustomed to just being in the hospital at Children's Hospital Westmead, and I'd been there for maybe 5 years, and then it became quite overwhelming when all of a sudden it was as though I was losing all of that support, and I had to swap all of those people with a completely different staff team, new doctors, new location, new everything. And that wasn't the only thing that was happening at the time, like as what the other people were saying. Like, I had only just got my license to drive. I was living out of home for the first time ever, and I was applying for work, and I was applying for university. So it was a lot of things to actually consider during that time, and it was quite overwhelming. So I would have really benefited from a website like this, because it would just be awesome to be able to just hop on and just see exactly where all of the different support services are, to see some of the different like flow charts and stuff like that, to see exactly which stage happens next. So it's not as overwhelming, but more predictable and more easy to understand. I would have very much benefited and used this website if I was 18 again. I also had a lot of help from an organisation called Trapeze, which basically is like a transition program where they have a physio, an OT, and a social worker, and they helped me navigate that first year. But it was a short period of time, so I think as much autonomy that I would have been given through this website as possible would have been really helpful as well. So yeah. That's a little bit about me. Let me share a little bit about the peer support service as well. So because pediatrics peer support is quite new, what I currently do is I will either be hopping on telehealth sessions, or reaching out to parents, or the individual themselves if they're old enough. Like, I've got a phone where I'll ring them and just check in and see how they're going, ask them all the questions about their health and stuff like that. But the main thing is the fact that I'm not giving advice from a clinical standpoint as if I was a doctor or a nurse, but from my own lived experience. Often people will ask me questions about what I do and how I overcome the struggles that both of us have gone through. And it's always from a lived experience standpoint, rather than just a doctor saying this is what you should do. Yeah, and we currently also have a team that visit different hospitals in New South Wales, and we basically go to Prince of Wales, we go to other hospitals, and basically we just go and check on the spinal injury units and see how the patients in there are going, deliver peer support there. Yeah, that's a bit about peer support from Spinal Cord Injuries Australia. Yeah.
Thank you, Dean. And thank you for the work you do in the whole peer support team. I know they're invaluable to the young people and the parents that they encounter during their time in hospital and the community. So thank you. I'd now like to welcome Jodie Thompson. Jodie is an experienced clinical nurse consultant of over 26 years. She spent most of her nursing career in the pediatric disability, working in pediatric disability, including spinal cord injury. And in 2003, led the development of the Pediatric Outreach Service in the tertiary pediatric hospitals in Sydney. So Jody now leads the Kids Collaborative, a pediatric nursing service. So Jody provided feedback as a healthcare professional into the development of the SCI Healthcare Transition website. And she's going to tell us a little bit more about the work she does and her experience in this area.
Great, thanks, Emily. Now I have to apologise. My son has gifted me with COVID this last week, so I apologise now for the husky voice. I've been very excited to be a part of this project. It's something that has been many years coming to fruition, and I think this has been just the most wonderful development and stuff for people with spinal cord injuries and how we can support our young people moving between paediatric and adult healthcare services. As Emily was saying, I actually finished up at the Children's Hospital in December last year, and I'm now working privately in the community. But I'm just going to reflect on some of from my health professional experience about kind of, being involved with people with spinal cord injuries in that paediatric system for the last 10 years. Actually, it's probably like 13 years now, as a clinical nurse consultant for outpatient spinal cord injury is kind of what my role was. And within the pediatric system, there's actually not that many pediatric clients coming through with spinal cord injuries, unlike with the adults. And so we have, maybe 14, 15 clients who are new clients that are coming through each year and things. So we have about on average about 5-6 clients that might be transitioning every year onto adult services. The discussions around how we used to do transition and things like reflect back to about 2009 when we noticed that there was a lot of clients that weren't making it to the adult health services. We might have been having conversations about, where you're going to be transitioning to and what we're going to do maybe in that last year or two prior to that transition. But often those conversations and things were very much, you just go see the adult doctors. Here's your referral, go and see them. It was a bit of a mystery and a bit of a leap for people to kind of go from this being in a very supportive pediatric environment where you would be offered appointments every year or every 6 months or so. By the time that you left pediatric services, you might only be seeing once or twice a year. So that opportunity to be able to do some intensive sort of work around independence and things like that very much used to fall, I suppose, to a lot of the pediatric spinal outreach service who used to work closely with the kids about how we can kind of help them to get a little bit more independent with some of the skills that they required to be able to engage, I guess, with adult health services. And it was only until we started talking to some of these young people who had moved on to adult health services, we realized some of them fell away from all health services. And again, as Emily was saying about, they often got readmitted with complications to the adult system. So we questioned about how can we do these things better? So it was in about 2009 that myself and representatives from the Pediatric Spinal Outreach Service and Selena Rowe, who now is the General Manager of Royal Rehab, she was actually the manager at the time of the Spinal Outreach Service, the adult service. And we had conversations over Tim Tams and coffee at the time, I do recall, about how we can improve this process. So the three of us, Marika McPhail, who used to be the physio on the Pediatric Spinal Outreach team, Selena and myself went out to see a lot of the adult services and actually speak to them about how we could improve that process. So the conversations around this stemmed from a long time ago and eventually led to the development, along with consultations across with our Randwick counterparts, our John Hunter. We spoke to the actual transition network, ACO, which used to be GMCT at the time. And eventually we did come up with a flow chart, which you may have seen along the way. I don't know. You can't probably see it. Like the backgrounds and stuff. That style, anyway. It was a flow chart that actually kind of talked through at the different ages and stages about what sort of things we needed to start thinking about to better prepare our young people for moving on to adult healthcare services. And part of the things that were identified by the adults is like, one thing you guys do terrible is trying to get the kids as independent as they can, not only with self-cares, but their ability to be able to have like the health literacy and being able to manage a lot of their potential for health conditions or complications, about how you go to prevent that. The other thing they tell that was fed back is that discussing a lot more and support around sexuality and sexual health and things like that were lots of questions that were never really well discussed, I guess, in the pediatric services. So we went about kind of trying to make those conversations more apparent in our clinics. By the time the kids were about the age of about 16, we're starting to take them into clinics by themselves so that they were able to tell their own health stories and be able to identify their health needs, so that by the time they moved to like an 18-year-old, they could start to do that, and it was a less of a leap to go into adult healthcare services, and they could feel like that they could identify those needs and be able to seek help when it's needed. So very much moving from places where we would offer all that help to them to moving to a different mindset where they had to identify what they needed help with. And that was something that was a little bit of a change in mindset, I guess, throughout those kind of later teenage years and things. Also, just to mention in pediatrics, depending on the age of which the child or young person had their spinal cord injury, the family very much go into a nurturing mode of getting them through that process of getting used to their newfound life, of what differences that made. And so that very much that nurturing role, it extends all the way through to when they're kind of that late teenage years. So a lot of these children are actually quite protected by having their families do a lot for them. And so when they actually, we actually have to make a particular point of like, okay, you're now kind of 16, we want you to actually start to be able to do some of these things yourself. And it was really important for, I suppose now as part of our clinics and things, is that we're doing that a lot more. The discussions and things are very much directed towards the young person, getting them to identify their needs, and their parents are there for support. And so I think that over the years, definitely, we have made lots of great changes in regards to how we introduce that. There are support from, again, Trapeze, which is our transition service of the Sydney Children's Hospital Network. There's also transition coordinators out there from ACI, that if people get a bit lost and they're not quite sure who they need to go and see or where to source services, that's where they can kind of get in contact with the ACI coordinators and things. So that tends to work quite well. So this transition website that has been developed is just wonderful, can be used as a transition tool for clinicians. I know myself as a clinician in clinic, I would be looking to that website to actually go through with families, looking at with a young person going, this is where we're at the moment in our journey to adult services. And these are the things that we're going to need to start thinking about. And I think it's just been, this website is kind of like the dream of what I would see as an ideal resource for not only for young people and families, but actually for clinicians as well, to help lead those conversations about how we can support people better, young people better in moving. And also thinking about, which is what we're doing now, I guess, is that we're trying to encourage the young person to go and see their adult-based clinician, but still have one other pediatric appointment left to make sure that we've tied up all the loose ends. And I think that crossover now is working quite well. So we're just always thinking about ways in which we can do things better and improve that process. And it has been an evolution, but I think we're definitely moving in the right direction. And the importance of peer support and that development dean of your role within SCI to actually help to support young people, I think has been an extremely valuable role and things in helping to support young people through this process. So congratulations, Emily. I think this is a wonderful site. And I think that not only is it useful for people with spinal cord injuries, I think this will have lots of flow-on effects for people with all different conditions. This is not just for spinal. I think the elements of this website will be very useful for many different conditions. So congratulations. I think this is wonderful. And thank you for allowing me to talk today. Apologies for the croakiness.
No, thank you, Jodie. Thank you for your insights and your experience and expertise that you provided to the project was invaluable. So thank you. I'd like to kind of use the remaining time to run you through the website and show you some of the features. So the website was really designed with the aim to support young people with spinal cord injuries, achieve greater healthcare independence, to support the smooth and coordinated handover from children's to adult healthcare services, and to offer young people with spinal cord injuries a way to access peer support. So to achieve this, the website includes a step-by-step guide to healthcare transition that is categorized by age and includes tools, tips, and resources to prepare the individual for the move. So the division of steps by age was informed by international and national key principles for transition and evidence-based references. So for example, GOT Transition is a federally funded national resource center in the United States that aims to improve the transition from pediatric to adult healthcare through the use of evidence in the development of strategies for healthcare providers, young people and their parents. ACI and Trapeze, as we've heard about earlier, they've published a report on the key principles for transitioning young people. And then I was also guided by this document that Jody, I believe, was trying to show before, that kind of looks at the transition phases and the age ranges and what kinds of tasks we would like to be addressing at that time. So using all of these, I went through the different age stages and thought of tips and tools for each age group. So age 12 to 14 section focuses on learning about spinal cord injury. It provides a medical summary template that users can download, save to their computer, and fill in as they learn about their injury. This provision of the medical summary aims to fulfill their recommendation for a portable and editable handover document, and it starts to build up their knowledge, the knowledge within the young person about their spinal cord injury and the health services they receive. We also start introducing tips on how to speak to healthcare professionals and what to ask them about the transition process. Aged 14 to 16 builds upon this kind of development of knowledge about the injury and services, as well as introducing a healthcare planning goal worksheet. So this worksheet aims to support young people create SMART goals, and if you work in healthcare, you've probably heard of SMART goals before, but essentially they're specific, measurable, attainable, realistic, and timely goals to achieve skills that they need to navigate the transition process. So for example, an age-appropriate skill for the goal planning sheet would be to learn about what medication they take and what they are for. At this age, we also start to introduce these concepts of privacy and confidentiality and what are your healthcare rights, and we provide links to where they can find more information on these topics. By age 16 to 17, we really wanted to start to focus more on getting transition ready. So there's a transition readiness quiz for users to complete. It asks questions like, do you know what to do in a healthcare emergency? Do you make lists of questions before you see a healthcare professional? And at the end of the quiz, it provides you with your responses, and any questions where you indicated no, it directs you to resources and tools to help change that response to a yes. So for example, if you answered no to, do you know what to do in a healthcare emergency? The website advises the user to talk to a healthcare professional or their parent or a peer support worker about what to do, and directs them to review the questions on or the tips on speaking to a healthcare professional and how and provides a link on how they can access peer support. In this section, there's also an editable transition readiness checklist for users to either complete on the computer or print out. And we draw attention to the fact that there are other normal developmental tasks going on at this, normal developmental changes going on at the same time. So the transition to higher education, relationships and sexuality concerns, and also mental health challenges. And we direct them on where they can go to find more support. Age 17 to 19 has a checklist for determining whether you're ready to transition, and if not, kind of directs you back to where you can find more information and support in the previous stages. So in addition to this kind of step-by-step guide to transition, the website aims to provide users with links to services such as inpatient, outpatient, and rehab services, community services, transition support services like ACI and GPs, but also helps to support their mental health and well-being, as this is quite a challenging time for both young people and their parents and caregivers. Young people and their parents, they also wanted more information on spinal cord injuries in the transition process. So this resource page kind of brings together all the resources from the step-by-step ages and provides links to where people can find more information. I was really aware that the website could not provide all the information that young people and their parents wanted, and that there is already a wealth of information out there on spinal cord injuries, what they are, bladder and bowel dysfunction, how to exercise with a spinal cord injury. So I felt like the best use for this website was to focus specifically on the transition period and then direct visitors on to the wonderful resources that are already available and held on the Sydney Children's Hospital Network website or the ACI Spinal Cord Injury Network websites. So that's what I've tried to do. The My Healthcare Team page introduces young people and parents to the types of healthcare professionals that they may already use or that are available. So you can click on each name and it brings up a box of information about the healthcare professional and where they can read more about them. And another recommendation from young people and their parents was to have this template in which they can match their list of contact details from their current pediatric providers with their new adult healthcare providers. So for example, which adult urologist will be taking over from their pediatric urologist. And then lastly, this peer support element, and as you've already heard from Dean, where we've got some videos highlighting top tips for transition and where people can access peer support. So there are a few things I would like to emphasize as we draw to a close. Firstly, the evaluation from young people who participated in this project indicated that being included in the co-design process was empowering, it gave them voice, and it provided them with an opportunity to be involved with something that will have actionable change in their lives. I think this really emphasizes the importance of giving young people with disabilities the opportunity to participate in research and in the development of interventions that will affect their lives. The website is live, so please go and explore it and provide your feedback on the site. The link will soon be found on the PSOS website, so you'll always know where to go to access it. Lastly, preliminary evaluation indicates young people with spinal cord injuries, parents, and healthcare professionals believe the website will support the transition from child to adult healthcare services and will equip young people with spinal cord injuries with practical and helpful tools to take charge of their healthcare. So my hope is that for the healthcare professionals listening today, you'll be able to use the website alongside your current transition process to help provide more information and guidance to the transition process. Maybe if we do this, the young people we work with won't have to make the choice between staying home with a urinary tract infection or going out on that university pub crawl. As we wrap up, I would like to invite anyone that has any questions or would like to speak to me further about the intervention to email me at the address on the screen. Also, in an effort to continue to evaluate and improve on the website, I'd greatly appreciate any feedback via the online survey you can access by the QR code on the screen. So once again, thank you for joining us today. Thank you to all of our speakers and to everyone that has been involved in the development of the intervention and the development of the website, and in supporting me on my PhD journey. I hope you found the webinar informative, and enjoy the rest of your day. Thank you very much. I'll just leave the QR code up if anyone wants to do the evaluation, but don't feel like you have to stay much longer.